Good afternoon and welcome to the start of WorldOregon's webinar today, Great Decisions 2021, Roles of International Organizations in a Global Pandemic. A weighty and important topic that we'll get to in just a minute with our distinguished guest, Professor Chunhuei from Oregon State University, a longtime partner of ours, and he comes highly recommended by several other speakers, including Professor Nichols, who's spoken for us today before. So looking forward to his talk in just a minute. As usual, I'm just going to have a few opening announcements. A reminder that we do these talks as part of our partnership with the Foreign Policy Association. And through the Foreign Policy Association, you can order the book, and I'm posting in the chat the link where you can order the book. There's also a Kindle version through Amazon and other materials like the DVD. Also wanted to make sure everyone had a chance to join us for the International Speaker Series, which is our other big series of speakers going on this winter and spring. And again, posting in the chat where you can purchase tickets for that. We are selling the three-part series for the remaining 3 speakers, as well as individual tickets are now on sale for all events. I would note in particular that the next talk is very relevant to this. It's on, it's Maren McKenna, award-winning science and medical author and journalist, in conversation with Dr. Marcel Kerlin from OHSU Infectious Diseases, talking specifically about COVID-19 and what's going on. The title of that talk is COVID-19 and the Path to Recovery. So we're going to dive into some of those issues today, and we'll dive into more of that next Thursday, the 25th. As a reminder, this event is for WorldOregon members and other guests in the community. If you're not a member already, we encourage you to join us. We will be recording this for future posting on YouTube, so please mind your P's and Q's. If you have questions for your speaker, please post them in the Q&A function. We try to reserve the chat for links or other sort of questions not directly for the speaker. So if you have questions for the speaker, please post them in the chat. And around about 12:30 or so, Tim DeRoche, our Director of Programs, will come on to moderate the Q&A with Professor. And now, without further ado, I'm going to introduce our speaker for today. As I mentioned, he is a professor at Oregon State University in the College of Public Health and Human Sciences. He has a distinguished academic pedigree with his bachelor's from China Medical University in Taiwan, a master's of public health from the University of Texas School of Public Health in Houston, and then a doctor of science in health policy and management from Harvard. He teaches a wide range of classes and interests at Oregon State University, and we are thrilled to have him tackle this challenging question, the role of international organizations in a global pandemic. So without further ado, Professor, the floor is yours.
Thank you, Derek, for your introduction. Good afternoon. It's a great pleasure to be able to share with my research and knowledge with everyone. I'm going to start sharing my screen. So today's talk focusing on the Great Decision 2021, the role of international organization in a global pandemic, and I specifically titled my talk as the COVID-19 pandemic and the future of global health governance. Since about 10 years ago, one of my research focus has been started to develop around the issue of health governance, both domestic and global. And also, a little bit of my background related to the pandemic. I originally came from Taiwan. Because of that history, in 2003, I have been closely watched daily about the progress, the development of SARS. And because of that knowledge, that stimulated me to start following what happened in Wuhan, China since December 2019. And my today's talk are divided into three sections. The first part on the COVID-19 pandemic, what went wrong? And I will compare with the 2003 SARS. And then the second part, the core part of today's talk is the role of WHO and nation state in preventing and controlling a pandemic. And then the last part, we look to the future about the future of global health governance. So let's start with the first part, the COVID-19 pandemic and what went wrong. And when I follow the development since December 2019, by late February last year, I came to the conclusion that particularly WHO had responded swiftly like it did in 2003 SARS, we would not be in this pandemic at all. And so the first part, what went wrong? And I'd like to use an analogy of a disaster. And some of you might be familiar with the 1984 Bhopal gas disaster. That to date is one of the biggest and deadliest industrial disasters. And on the first 3 days, that disaster caused over 10,000 deaths and continue to cause fatality years later. And this was happened in December 3rd, 1984. And it was a Union Carbide fertilizer and pesticide plant in Bhopal, India. And one of the key ingredients for making those pesticides was isocyanide. And it is extremely lethal, so it has to be kept in a liquid form in a low temperature. So when that factory was constructed, there was a lot of doubt and question. Is it safe, particularly given that highly potentially lethal chemical factory is built in the middle of a city center? So the Union Carbide gave the guarantee that they have the similar factory in Texas, and they applied and implemented exactly the same security and safety devices. More specifically, they have 3 redundant safety devices to prevent any accident from happening. In other words, for an accident like this to happen, all 3 redundant safety devices has to be failed at the same time. They even calculate the probability because all 3 devices fail at the same time. The probability is 1 in several millions. That literally impossible. But something is impossible did happen because all 3 safety devices failed. And I use that analogy to compare with this tragedy. This pandemic could have been prevented. So there are 3 levels of similar safety devices. First, the country of origin, if they disclose the nature of the disease early enough, we could have prevented that from spreading outside. And secondly, this is the core focus of today's talk, the failure of global health and governance. In this particular case, if WHO was able to respond swiftly like it did in 2003 SARS, this whole pandemic could have been prevented. And in my observation, both the first and second safety devices did not work this time. And that only left to the nation state. And later I will share, each nation has a different way and different timeline to respond. Some countries respond very early, some countries respond very slow and very late, and somewhat less effectively. And those countries, particularly Taiwan, Singapore, Hong Kong, and Vietnam, these 4 countries were hardest hit in 2003 SARS. They all learned the hard lesson. And in a way, those four country origin had 16 years to prepare for that. And that partly contribute to this four-country origin being among the most successful area in combating this pandemic. And here I summarized some of the key timeline of this pandemic. Based on the currently available literature, the first case actually can date it back to November 17, but recently there has been more information floating around suggesting the cases might already be detected as early as September of 2019. And here's some important event. December 20, the manufacturers of mask and protective suits canceled their meeting, the trade meeting in Hubei, that's near the Wuhan. There's a good reason why they canceled it, because they already sensed there's something serious going on. December 30th, 8 physicians in Wuhan, in its hospital, including the famous Li Wenliang, the whistleblower, they sounded the first alarm. And that first alarm, unfortunately, was silenced by the Chinese authority, and the outsider did not pay much attention, whereas Taiwan, Vietnam, Hong Kong paid lots of attention, because their alarm was there's something highly contagious going on in the hospital. And they already observed physicians and nurses got infected. And when you see physicians and nurses got infected, that's a huge alarm, because among of all the people, the clinicians, physicians, nurses, they are highly trained. They are highly trained to protect themselves. And if those highly trained professional clinicians got infected, there must be something very serious. So they were arrested for the reason on January 1st, they were arrested for spreading the rumor. December 31, 2019 was a very important date. That's the date that the Chinese National Health Committee arrived at Wuhan to investigate. That's the same day Taiwan warned the WHO IHR, International Health Regulation, on possible human-to-human transmission of the novel coronavirus. Unfortunately, WHO ignored that. And not only ignored that, but later in the dispute, WHO totally denied Taiwan ever issued that warning until Taiwan produced the evidence of Taiwan did send that warning. And I've been lamented, as WHO responded to that warning, the first warning, we would not be in this pandemic at all. On that same day, Taiwan was the first nation to take action. They started onboard inspection of all passengers flying from Wuhan to Taiwan. And here I listed Taiwan and Hong Kong's early response. January 2nd, Taiwan CDC held a communicable disease prevention consultation planning meeting in preparation for this unknown, potentially highly contagious disease. In a similar way, January 4th, Hong Kong investigation team returned from Wuhan and initiated highest level of epidemic control. So those early response become so vital in their success in containing this pandemic. It will take another 3 weeks that China officially acknowledge this is a highly contagious human-to-human transmission. Unfortunately, WHO went along. Granted, WHO has not have enough evidence, but WHO did not do its adequate homework to pay attention to non-official, non-government information, given that China was not disclosing that. And the sad thing about China not disclosing the contagious nature of this disease, not only it did not disclose to the world, it also did not disclose to its own people. As a result, the Chinese people suffered. From January 17 to 18, that was around Lunar New Year. Wuhan held regularly the world's largest potluck Last year, estimated over 40,000 people gathered in a big places indoor, share their dishes. And that provided the perfect ground to spread the COVID-19. Had those people knew the disease was spreading and contagious, they would not have held that over 40,000 people gathering. So that was the first day. Finally, that's 3 weeks late to acknowledge its human-to-human transmission. And then it takes another 10 days for WHO to announce the fight. And then on March 11, WHO announced the COVID-19 outbreak as a pandemic. And again, the June 5th, after at least 2 months of critical arguing and examination, finally, WHO issued guidance to recommend facial mask wearing for general public. And June 7, Taiwan was the first nation to lift all public gathering restrictions. And actually in April, in mid-April, Taiwan was the first nation in the world to reopen professional baseball games. And US CDC was also late to acknowledge that COVID-19 is airborne. And these iconic pictures tell a lot of stories about the relationship between the WHO Director General and China. And that was discussed in the article. And in the article also discussed how the Director Generals couldn't stop praising China's success. And in the article, it said there's a reason that the Director General want to appeal to China to gain their cooperation. But if you look at all the detailed tweets, I think he went above and beyond the appeal. He praised almost daily about China's success and effective control. And this was the human cartoon, the political cartoon published in Taiwan about that situation, that Taiwan not being a member, being excluded from the WHO, and didn't even granted Taiwan an observer status. So in the next section, let's begin to look at the role of WHO and nation state in preventing and controlling a pandemic. In the article, the author talked about the WHO's function and authority, particularly focusing on coordination, but does not have an enforcement authority, such as analyzing but not auditing, advising but never directing, etc., etc. But they also did mention in 2003 SARS, WHO's Director General went above and beyond what was sanctioned in that position, because she felt there's a global urgency to step in, given China's non-cooperation initially, that she had to use a more stringent method to prevent that spread of SARS. And because of that early action and unusual action, much part of the world, particularly Europe, South America, Africa, was spared from the spread of SARS. And there have been stories that about how timely the WHO's warning came out that prevented passengers flying from Hong Kong, from Asia, Europe, who potentially carried the SARS virus to spread throughout Europe. And because the timely warning allowed the European country to quarantine those passengers. And as a result of 2003 SARS, the international health regulation was already in place. But because of the disastrous SARS epidemic, most member states felt the existing international health regulation was totally inadequate. They want to improve it, revise it, prevent another SARS from happening again. And that led to the 2005 a massive revision and expansion of IHR, and also implement the FIC, the public health emergency of international concern, which before the current COVID-19 was announced 5 times. And in the article, it mentioned the IHR 2005 has no T's. So that begs the question, the whole purpose of IHR 2005 revision and expansion was precisely to prevent another similar pandemic like SARS from happening, and yet it failed miserably this time. And so that leads us to the big question, what could have been done, or in the near future, what can we do to prevent this from happening again? And in the article, the author also mentioned that WHO is a political venue in which member states seek to advance their interests. And this was thoroughly exposed during this pandemic. And this is just for your reference. In 2013, WHO revised the pandemic phases from inter-pandemic alert to the announcement of pandemic and then the transition. In the article, the author mentioned about one of the shortcomings of the current structure of WHO that has to do with its funding. And the funding problem is not new. It started in the beginning of 1990, but WHO had a shortfall of funding for its programming. So in the 1990s, WHO started to welcome donations. And those donations were not from individuals. They were largely from big corporations, big organizations, and governments. And by the beginning of this century, if you look at WHO's operating budget, the so-called extra budgetary programming, those funding coming from voluntary contribution, at the beginning of this century already exceeded its regular budget. And by now, of the total budget for this current calendar year, 80% were from the donors, only 20% from the institutional budget. And that creates a problem, the donor-driven programming, because the highest governing body of the WHO is the World Health Assembly. But those extra budgetary programming, they were largely immune from the Global Health Assembly because they are donor-driven. And given they are donor-driven, it is safe to say at the current structure, in terms of the budget, about 80% in terms of the spending of WHO's programming were outside of the global health governance. Instead, they were following the new golden rule. And this is the golden rule of global health. Who has the goal, sets the rule. So what went wrong with the IHR? Earlier I mentioned WHO ignored the critical warning and also ignored the non-government sources, even China initially not disclosing it, of the highly contagious nature. Also, WHO delayed the announcement of FIC and pandemic status, and the article talked about how challenging, how difficult it was for WHO to make that decision. But in addition, in numerous occasions, WHO issued incorrect messages, such as do not ban travel, and facial masks will not protect people. And also, WHO ignored non-government information on the contagiousness of the disease. By now, we have solid evidence that the disease was already spreading in China long before they announced it's contagious. I earlier mentioned this interestingly, those evidence were provided by Chinese researchers, not by other countries. Chinese researchers' publication indicated to date, they investigate cases as early as November 17. And at least 2 papers published in the leading journal, Lancet and New England Journal of Medicine, by China's CDC official and academic researchers, they disclosed in their measures section, they started collecting those samples at the beginning of December 2019. And that means the spread was already begun before December. And so all this shows the solid evidence provided by Chinese researcher how early that contagiousness was already known to the Chinese authority. And there's also one controversial issue raised by scholars around the world. Those Chinese CDC researchers and academic researchers, they knew the contagious nature, yet they themselves did not disclose to the Chinese people. And as a result, Chinese people also suffered. And there was several calls for Lancet and NEJM to retract their papers for ethical reasons, because those researchers, they want to publish in the top journal, but they did not disclose the high risk of contagiousness to their own people. And I always thought that we wish the 2003 WHO would be the one that responded to the 2020 COVID-19, yet we were not able to institutionalize it. In other words, that's the key subject of today's talk. Today's issues, the international organization's role in this pandemic. And for that matter, not just WHO, basically all UN agencies are powerless when facing a superpower's non-compliance. On the last section, let's look out for the future of global health governance. So this is what I mentioned earlier, the triple safety devices. And in this time, the first one, the second one failed. That led to the last one, the national policy and societal response that resulted in very different responses. I have been presenting those tables for dozens of my webinars. So I just updated this last night. US, one of the least successful in pandemic control, compared with 3 other more successful countries. And you can look at the case per million. US is 86,000, and Australia about 1,000, Vietnam 24, Taiwan 40. The deaths per million, US has 1,500, over 1,500, Australia 36. And both Vietnam and Taiwan extremely low, 0.36, 0.38. And the daily new cases per million for the last 14 days, US is in the range of 167 to 392. Australia 0 to 0.4, Vietnam 0 to 0.5, and Taiwan 0 to 0.2. And Taiwan is especially remarkable because Taiwan never locked down anything. That all its facility, from school to business to restaurant, remain open throughout all the time. And this from our world in data. It compares several countries that include Taiwan and Vietnam, I mentioned, and Australia, Singapore, these are the, and Iceland, New Zealand, South Korea, these are the other relatively successful countries. And it look at the government stringency index. Taiwan is actually very low, and New Zealand also very low in the later part. But what's important is how early they implemented the stringent effort in January, where many other countries implement much later. And it's important to note that the US CDC used to play a much more proactive role, particularly in the 2003 SARS. It worked with WHO and sent delegate, and one of my friends was part of the delegate, to Vietnam to investigate the SARS and determine the highly contagious and lethal nature of that disease. And unfortunately, the CDC Global Health Surveillance Program, the funding was cut after the previous administration. And without that funding, it's basically remove the function of the global health surveillance. And that also one of the contributing factor to the US being partially blinded by the important nature of the current COVID-19. And this is again, the comparison of our data in terms of economic decline. And you can see the country with higher confirmed deaths per million also on average suffer more economic decline. And here's Taiwan, here's US. And actually Taiwan is one of the very few countries in 2020 actually had a positive economic growth, when the vast majority of countries had a decline of economic growth. And Taiwan, together with several other countries, shows that protecting life can also protect livelihood. So one of the big question is, what have we learned from 2003 SARS? Who has learned and who didn't? And why there was no vaccine developed for SARS-CoV? And both SARS and COVID-19 were started in China. In both cases, China initially tried not to disclose it. And SARS killed a total of 774 people, infected a little bit over 8,000 throughout that period. But the COVID-19 has killed 3 times that many people in just 8 weeks. And it's important to note the COVID-19 virus share about 80% of its genome with the SARS virus. That's why its virus is named SARS-CoV-2. So here I leave some of the issue for us to consider. When we think about global health governance, what are the motivations and what are the framework we can think of? And this, what I listed here, is not an exhaustive list, but probably most of the important one. And some of them, they can overlap with others. And the COVID-19 pandemic showed us the future or challenges of the global health. First one is the new public health and global health. How can we reform the global health governance of public health? And it also presents a challenge of politics versus science, including issue of misinformation and exclusion. And also another challenge is, are we going to be a global community, or are we just a bunch of global villages? And this pandemic revealed the ugly pandemic nationalism, which national interests often conflict with global interests. So we have a big homework to do in the near future about global health governance, especially about the global public goods, such as pandemic control, prevention, and vaccine. And I'd raise more questions about who determined global health priorities. WHO has been based on burden of disease, but it has some issue about focus on disease versus paternalism, and it ignored political economy that shape the distribution of diseases. And there's also contested global health priorities, universal versus place-based. And we also need to recognize, besides WHO, there are many other key global health actors. On the right hand, there's a conglomerate of called H8, the 8 most powerful actors, including WHO, World Bank, Gavi, Global Fund, UNICEF, UNFPA, UNAIDS, the Bill and Melinda Gates Foundation. But in addition, the transnational corporations, United Nations, WTO, particularly TRIP, the nation state and community is where real action takes place. And then other non-state actors, they all play a role in global health governance as well as in the pandemic. And the pandemic also has increased global poverty for the first time since 1998. That shows the urgency of how soon we should contain this pandemic. And finally, I leave the quote from Robert Marley, who said, COVID-19 has laid bare the cost of confronting global crisis with a flawed international system. And the only worst outcome will be to confront the next crisis with no system at all. So how can we imagine a different world? Are we allowing the pandemic to reshape the world, or what kind of world do we want to moving forward rather than return to? And that's conclude my talk today. Thank you very much.
Great. Thank you so much, Professor Chi. This is Tim DeRoche, the Director of Programs. We're getting some good questions coming in. And I'm going to start off with one. I'm curious, do you see any correlation between how liberal democracies versus more authoritarian governments navigated the pandemic and its response?
Yes, this is a question was debated as early as last April. And there have been some researchers did a little bit of a comparison, and they found overall there is no definite relationship between an authoritarian government versus a democratic government's effectiveness or ability to contain or control the pandemic. For example, there are authoritarian government that's not being very successful in containing this pandemic. There are also authoritarian governments that have been successful, such as Vietnam. And likewise, we can find lots of examples of how democratic government either being very successful, such as Australia, Iceland, New Zealand, Taiwan, Singapore, in containing this pandemic. And many of the democratic government, such as many Western European countries and the United States, has not been very successful. So there is no definite relationship between being authoritarian versus being democratic. Ideally, we would like to see a democratic government being more responsive, more effective, but unfortunately, we don't have a concrete evidence at this point.
So what is the single most important realistic change that the WHO could make to become more useful? And is that likely to happen?
Those of you who read the article, I think the article laid out very clearly in the analysis that the member state wants the WHO to be more effective in preventing a pandemic like this one. And I personally wish the current WHO would be more responsive like the 2003 WHO. But at the same time, its constitution and its funding limit WHO's capability. In particularly, most nation states would not want WHO to infringe upon its nation state sovereignty. And I also raise one of the key question, key doubt about WHO and UN in general, that even if WHO or UN agency has teeth, but if the country who violated the compliance happen to be a superpower, then those teeth become useless. And unfortunately, in both cases, 2003 SARS and the COVID-19, the country that did not comply with the IHR happened to be a superpower.
So how did Taiwan manage to be so successful without having lockdowns?
Well, Taiwan is not alone. Well, I mentioned there are several countries like Iceland, New Zealand, Vietnam. And interestingly, when I give a talk to a group of academics on the similar subject, during the Q&A, one Vietnamese doctoral student kind of challenged me a question. He said, Dr. Ji, do you know what Vietnam and Taiwan have in common that allows them to be very successful in containing this pandemic? And I said, yes, they both suffered from the SARS 2003. So they have that experience, they prepare. He said, yes, but there's another important factor. So I asked him, what factor? He said, both countries did not trust information from China. So Taiwan was burned badly, hit very hard in 2003 SARS. And Taiwan learned the lesson because in 2003, China did not disclose that information for over 6 months. And Taiwan suffered. And so since then, Taiwan decided Taiwan need to collect critical information of its own. And because Taiwan has such a close economic relationship with China, huge investment, over 1 million Taiwanese long-term residents in China. Last year, there were, not last year, 2019, there were 6 million visits by Taiwanese between Taiwan and China. Based on this information, actually, last January, Johns Hopkins Research Center predicted Taiwan will be the hardest hit country in the world by the COVID-19. But it turned out to be the opposite because Taiwan, like Vietnam and a few other countries, prepared for this for literally 16 years since 2003 SARS. And I'm hoping that all countries will take a hard lesson from this current COVID-19 and will never be caught unprepared again, because Taiwan decided at the end of 2003, Taiwan will never be caught unprepared for another epidemic or pandemic. So Taiwan, I mentioned some of the examples, took very swift action as early as January 2. And that's extremely unusual and not easy for democracy. Taiwan is a full democracy. And for a ruling party to take that action, well, they were struggling to fight re-election. Taiwan had a general election on January 11, 2020. And so they were devoted all their energy for re-election, yet they could spare energy to pay attention to this emerging crisis. And that's unusual. And so they took so many steps there. By now, there are over 200 media articles published detailing and dozens of academic articles published about Taiwan's success. So I will not bother with too much detail. That reader who are interested, you can Google that or the Scholar. Google Scholar also have a lot of those articles.
So your examples of successful countries seem to be isolated to island states. I'm wondering if you can speak to that. I mean, is that an accident to not share borders, or?
Well, island state has advantage, but not every country can take that advantage. UK and Ireland, they're island state, but they have not been very successful. Whereas Australia, technically, it's not an island state, it's a continent. But Australia was able to contain it very successfully. So yes, island state has an advantage, but not every country can take that advantage or will take that advantage.
So do your criticisms of the WHO, including the Golden Rule, apply to international agreements that address climate, such as the Paris Agreement? And if so, what must the US and other wealthy countries do differently to lead global efforts that address these existential challenges to humanity?
Well, one of the key motivation has to be more altruistic. Oftentimes, many of those international development funding or aid are motivated with a mixed motivations, including a little bit of altruism, but a lot of self-interest. And the bigger issue of climate change that will and already started to affect people on Earth, that will take a concerted effort. And this concerted effort requires some sacrifices by the wealthy country. By sacrifices, it include a wide-ranging issues. Besides reducing the CO2 emission, the advanced or high-income country need to assist the middle low-income country with new technology so they can reduce their CO2 emission to preserve energies, to preserve the environment. And this requires knowledge and technology that oftentimes are withheld within a high-income country. And in addition, all countries, particularly the rich country, need to realize the climate change will affect everyone on Earth, not just the people in the low income countries. And in order to slow down or prevent that, it need to take extra steps and some sacrifices. And that is not easy.
So what role do you see for the WHO in global vaccination rollout?
The vaccination is the part that I would praise the current WHO did very well, but with limitation, as the article mentioned, because the WHO, its governance has no teeth. And last year in June, WHO together with Gavi, they designed a very ideal, equitable distribution of vaccine, the COVID-19 vaccine called COVAX. And the idea of that COVAX mechanism is for wealthy country to invest early time for the development of vaccine, and using wealthy countries' financing to subsidize low-income countries' access to the vaccine once they become available. So it has a priority and mechanism to distribute. For example, one high priority is across the board, irrespective of rich or low-income countries. The highest priority is the frontline healthcare workers, because that if we treat this as a battle analogy, the frontline health workers are fighting in the front line. We have to protect them. So that's one of the high priority WHO want to implement. But the reality is that WHO has no teeth, and despite that agreement, many wealthy countries went by themselves to have struck a private deal with manufacturers. 2 days ago, I saw one news article published that 10 wealthy countries, that including big and small countries, by now claim 75% of total available vaccine. They're extremely inequitable. And several countries such as the UK and other countries, they actually procured way more doses than its total population. Yesterday, one report showed that UK purchased 5 doses of vaccine for every citizen. And so the rich country were able to circumvent the COVAX and got ahead of everyone else, and that leaving in over 180 countries behind. And that extremely inequitable. And 2 days ago, French Prime Minister Macron came out to argue that the rich country, especially those who overprocured vaccine, should be willing to help low-income countries, particularly Africa, to share their vaccine. And so, yes, WHO came out with a very good idea, good mechanism, but just like other issues, WHO has no teeth, and it cannot prevent wealthy country to run on its own.
So in the US, we've got a fairly strong subculture of anti-vaxxers. Is that a challenge or an issue in other nation states around the globe?
Yes, US is not alone. There are some European countries. I have a friend in Europe share that information with me, say they are also facing some anti-vaxxers. But my observation is, given that there are anti-vaxxers everywhere, it seems the US is have a greater influence by anti-vaxxers. But what my concern is not, for the US, my concern is not just the anti-vaxxers, because we are facing, besides anti-vaxxers, we are also facing what I call the pandemic denier. Despite we have over 500,000 deaths, there are still a sizable, I don't know the exact percentage, but that percentage could be anywhere between 10 to 20%. There's still a sizable American to this day still think there is no pandemic. The whole pandemic is a hoax. And I have graduate student who personally told me, she came from a rural area. She said, all her family relation and her community member belong to that. She was alone in her community, that all her community believe that the whole pandemic is a hoax. So for those people, if they don't believe there's a pandemic, they would definitely not accept the vaccine. Why would you want to take a vaccine to prevent a disease that doesn't exist? And then we also have another group of people who are not anti-vaxxers, but who are more cautious. They recognize, I also have friends belong to that group. They recognize in regular procedure, a vaccine will take about 2 to 3 years to get approved. But this time it takes less than 1 year. So they are not anti-vaxxer, but they are more reserved about the safety and effectiveness of the vaccine. So all together, the three group, anti-vaxxers, the pandemic denier, and those who are more reserved about the safety of vaccine, they can still somewhere between 25 to 30% of Americans. And I think last week, CDC has a survey that actually struck me. The CDC's data showed that among the health workers who work in long-term care facility, there are over 1/3 of them did not want, they are on a high priority list, but 1/3 of them, they do not want to be vaccinated. And I was interviewed by media about this. I said, well, among the long-term care workers, they also represent the general profile of Americans. So if there are approximately 1/3 of Americans who either hesitate or resist to vaccinate, and that will reflect in the long-term care workers.
So we've got a great question from one of our board members, Mary Yates, and she says, leadership matters, and clearly there were different WHO directors with different leadership styles during SARS and COVID. I think of Margaret Chan, for instance. What can be done to find strong leadership for the WHO? Because it seems as though Tedros has sided so closely with China and should perhaps be replaced.
Yes, that has been a quite common criticism, particularly the initial stage, that my opinion is, had Tedros been more aggressive, such as Graham Holland of the 2003, we would not be in this pandemic at all. But again, that is a highly contested idea. And I know from the article, the author argued that we might be asking too much, because Graham Holland in 2003, she stepped outside of her authority because she sensed there's an urgency, a global urgency, that she need to act above and beyond her authority. And she was successful in preventing a bigger pandemic from happening. But that takes extra decisiveness and courage to do that, to go beyond what you are authorized to do. And of course, Tedros has been criticized being too cozy with China, and that seemed to be the opposite direction of Graham Holland.
So you explained the more rapid control of SARS to faster action by the WHO, but isn't another important factor when compared to COVID-19 that SARS is not as contagious as COVID-19?
Yes, but there's a different way of looking at contagiousness. SARS was very contagious, except one factor make it easier to control, make COVID-19 harder to control. That feature is, in SARS, we didn't see much of the asymptomatic patients. Virtually most people who infected with SARS demonstrated symptoms, so they are easier to identify. They are actually, in terms of the contagiousness, in general, they are more contagious. SARS are more contagious. The virus are much more tougher than the SARS-CoV-2 that caused COVID-19. But because we didn't have to deal with the asymptomatic or mild symptom infection, so from the population pandemic control point of view, it was easier to contain because you know who got it and you know how to isolate them. Whereas the toughest part of COVID-19 is the asymptomatic infection, that there are so many silent spread by people who are infected but have no symptom, and we don't know who they are. And that makes the facial covering, particularly mask, become extremely critical. And that's also contribute to one critical factor of Taiwan's success. Taiwan learning from 2003 SARS experience that before they have concrete evidence, they assume from January on that this disease could be like SARS, airborne. So they are the first country to implement universal access to surgical mask. The government consolidate, monopolize surgical mask for the first 5 months and ration that to everyone. So there's no excuse. Anyone cannot have the excuse that I cannot get a surgical mask, because everyone will guarantee. And that is an important factor contributing to Taiwan's success in containing it.
So I know you probably don't have a crystal ball, but I'm pretty sure that everyone who is on the program today certainly is asking themselves, when will things go back to some kind of a normal? And I'm wondering, just as a last question, what your thoughts are, and will we ever go back to a normal?
That's a good and complex questions. First of all, again, I like to point out that people in Taiwan already living a normal, I call it post-pandemic life since June 2020. And that normal life demonstrated in, for example, last November, the Broadway Phantom of the Opera, the whole team went to Taiwan to perform live in front of live audience. And on December 31st last year, Taiwan probably had the world's biggest crowd gathering to celebrate New Year. Over 70,000 people gathered for a big New Year concert. And that's the level of normalcy Taiwan experienced. We can potentially move to that. But there are a lot of moving parts or factors interplay on how soon and what kind of normalcy we can resume to. And right now, particularly for the United States, our pandemic since last October has largely in a form of out of control. By out of control, meaning we don't have the capacity or will or resources to contain it like the kind of stringent measure Taiwan or Vietnam or Singapore, New Zealand, Iceland implemented. Because this kind of stringent measure can work only when you have a small daily new cases. And so our hope is on vaccine, largely on vaccine. But at the same time, vaccine will not solve the entire problem. So I analyzed this issue in my last week's one of the media interview asked me the same questions. So the one first variable determining how soon and what kind of normalcy we can resume to is how fast we can mass vaccinate the population. And the second important variable, as many audience know, that this virus is capable of quick mutation. And some mutations are very minor, the vaccine continue to work, but some of the major mutations, such as the British variants, they change a lot, and that makes some of the existing vaccine less effective. They're not completely ineffective, they're just less effective. So this second variable is a race of time. The race of time is how fast we can vaccinate our population compared with how fast the virus continue to mutate. One common feature of the virus mutation is the more people it infects, the faster it mutates. And that's why I call it the race against time. And of course, we have many factors that we earlier discussed about how to overcome the barrier of mass vaccination. But the third important factor, I call it the old school factors. Even if we are able to vaccinate, say, 70% of the population, and the vaccine remain effective. That means we will not eliminate the cases like Taiwan, Vietnam. They have been seeing almost zero domestic cases where they quarantine the imported cases. So we will not be able to reach that right after vaccination. That means even after we successfully immunize, say 70% of Americans, we still need to continue to practice those hygiene safety practices, such as wearing masks in public indoor places. And the return to normalcy will not be immediate. It will be gradually. Even a successful country like Taiwan, they will transition to normalcy between April, when they mid-April, they no longer have domestic cases. It took them another 2 months to resume to almost complete normalcy. So that will be happen here or elsewhere, that after the vaccination, when our daily new cases reduce to manageable level, for example, using Oregon as an example, last spring, Oregon was seeing the daily new cases of between 40 to 80 cases. At that time, I strongly recommend Oregon adopt some of the stringent measures like Taiwan did. But unfortunately, we didn't, and that's lead to where we are. Because as the daily new cases of 40 to 80, many of the measures, especially quarantine and isolation and extreme contact tracing, are feasible. We have the resources, particularly human resources, to do that. But when our daily cases jump to over 1,000, we simply don't have that kind of resources. That's why I call it out of control. So if we are successful in a timely vaccination, and using Oregon again as an example, that say by late spring, our daily new cases will be reduced to less than 50 per day for the sick. Then we need to supplement with the old school method, the quarantine, isolation, contact tracing, by isolating, quarantining those who are still infected so they don't have a chance to spread the disease, spread the virus. Then slowly, we will be able to reduce our daily new cases to less than 10 and eventually to 0. And that's the date when we can return to full normalcy. So this will not be an immediate jump to normalcy. It will be a gradual, incremental process.
Great. Thank you, Professor Chi. I want to thank everyone for submitting great questions. I want to bring Derek back on to guide us out into the day. Once again, thanks everyone for joining us, and we hope to see you all next week.
Thank you very much.
Thank you, Tim.
It's been a great pleasure to sharing my information and knowledge with you.
Thank you, Professor. Really a comprehensive discussion and fantastic questions from the audience, and really a great precursor for our next International Speaker Series event, Thursday the 25th. I just posted the link in the chat where you can get tickets, where we'll be talking about COVID-19 and the path to recovery. So I hope you will join us for that. And next week, Great Decision resumes with Persian Gulf security issues. And 2 weeks from now is the Korean Peninsula. So again, a big thanks to OSU, our partner, Professor Chi, all of you for joining us. And we look forward to seeing you at our events next week. Stay safe. Bye-bye.
Thank you. Thank you. Bye-bye.